A hearty good afternoon and welcome to a session on endometriosis and fertility. We're glad to have Dr. Shiwali Tripathi among us today to help us explore this topic. Now, endometriosis is a disorder in which tissues that normally line the uterus grows outside of it. With endometriosis, the tissue can be found on the ovaries, fallopian tubes, and the intestines, which can be very painful. The above this, it also may affect fertility. But today we will learn how and if so. So let's try to understand this topic and ask the doctor any questions we have related to it. Doctor, you have the stage.
Thank you so much. Namaste, everyone. This is Dr. Shiwali, Senior IVF Consultant from Apollo Fertility, Varanasi. Today's topic is endometriosis and fertility. Many of you must have visited your family members, your daughter, your sister, your wife, who must be suffering in menses. So, any painful menses might be endometriosis. This disease is less talked about, less understood, but definitely a little dangerous. So today we will understand what is endometriosis, how does it presents, what is its prevalence and incidence, how does it causes fertility, and what are the options we are having with us to treat the disease. So, first we will start as told by our host that endometriosis is a problem in which the uterine lining is found outside the uterus. The places where it can be found is it can be found over the tubes, it can be found over the ovaries, your intestine, your urinary bladder, and it can be found outside the pelvis also. Like there are cases in which the endometrial tissue is found in the diaphragm, in lungs, in GI tract, in even in brain. So endometriosis is a problem in which the endometriotic glands, which is normally present inside the uterus, is found outside the body. It is believed that whenever the menses happens, whenever the uterus bleeds, these implants also bleed. So slowly they form a kind of cyst or implant, and these implants are chronic inflammatory implants. So they cause adhesions and scarring. So the prevalence endometriosis is not very rare. Approximately 1 in every 10 patient is suffering from endometriosis. The population which is visiting us, the fertility consultants, in them approximately 40 to 50% patients are having endometriosis. The disease is very enigmatic and mysterious. It takes time to manifest, and book says that there is almost 8 to 10 years of gap in diagnosis. Like the disease takes time to develop, and a patient who is having endometriosis might get diagnosed after 8 to 10 years of having disease. So disease is quite often late, and if you have taken long course, like if you are visiting your GP and then general practitioners, then for very long it can be like remain undiagnosed. So how does the disease present? Before that, we need to understand what is the age in which the endometrial problem of endometriosis we can see. So usually the presentation occurs in reproductive age group, like 20 to 35, 40 years of age is the age in which the uh, disease is being diagnosed. But again, it is very mysterious. There are cases, there are papers which report that as young as 8 years of age, uh, for the diagnosis. So a girl who is just 8 years, who has not attained her menarche, she was diagnosed with endometriosis. Again, it is said that it is a problem of female, but there are cases in which transgender and even males have been diagnosed with endometriosis. So it is definitely very difficult to predict who will get the endometriosis and who will not. Now, there are certainly some risk factors which can predispose an individual to endometriosis. Like if you're having a genetic disease of endometriosis, if you're having first degree relative of endometriosis, then there is approximately 6 to 8%, 6 to 8 times increased chances of having this disease. Again, the people who are having early menarche, who have started bleeding early in their life, or who are having very short cycle, if the cycle length is less than 26, 27 days, then also these girls are more prone to have this problem. Again, girls who are having heavy menses, like they are bleeding for more than 7 days in a month, so these girls are also more predisposed to have this problem. Again, the females who are at lower side of BMI, who are very lean, thin, who are not having good weight, they are also more predisposed to have the problem. Again, there are factors which can prevent individual from having endometriosis, like if the menarche is late, like if in late adolescence menarche has been attained, or if the pregnancy has been planned early, like infertility also predisposes to endometriosis. So pregnancy and late menarche, prolonged cycles, less bleeding. So these are the factors, and even smoking. So these are the factors which are having low risk for developing endometriosis. Now we will understand how the disease present. So endometriosis presentation is again very dramatic. It can remain asymptomatic. Approximately 20 to 30% of females don't have any symptom. They don't have any kind of pain or any kind of problem, and they are not aware that they are having any problem. And the prominent symptom in symptomatic females are pain, and pain is such debilitating that it will not let you do your routine activities. So how the pain presents: the first endometriosis diagnosis is made by 5 Ds. So if there is dysmenorrhea, which is excessive pain during menses, the pain is to such amount that you are not able to carry out your routine work. You need to take the pop of the tablets, you need to take rest, you are feeling feverish, so it might be endometriosis. The second D is dyschezia, which is painful passage of stools. So if the endometriotic implant is present between the uterus and the rectum, the ligament which is attaching the uterus with the sacral bone, uterosacral ligament, so in these patients during menses, passage of a stool is again painful. Third D is dyspareunia, which is painful intercourse. Fourth D is dysuria, which is painful act of micturition. And fifth D is chronic dull aching pain. So there are females who can have just chronic dull aching pain throughout the menses, throughout the month. It may be related to menses, it may not be related to menses, because it is said that the endometriotic implant might have altered expression of receptors, and these implant get activated in intermenstrual time also. So these ladies might have pain during in the in between period too. So these are the 5D. Besides this, chronic fatigue is the very common symptom which is designated to some other problem, but it is because of endometriosis. The second very common presentation in patients with endometriosis is infertility. Like we get couples in whom there is no cause which can be designated to infertility, which we cannot point out that this is the cause for infertility. Such patients might have endometriosis, which can be proven only by laparoscopy. So the two prominent symptoms of endometriosis is pain and infertility. Now we will understand how the problem is diagnosed. Uh, Usually, the diagnosis of endometriosis is clinical. If a adolescent girl, or if a adult is having very debilitating pain during menses, so it is mostly because of endometriosis. Such patients are given hormones, OCPs, NSAIDs, and if they respond, then it is proven that they are having the disease. But the definite diagnosis, the second thing, is through imaging. So a good transvaginal sonography can easily detect the adhesions. Retroverted uterus might be there, or there might be dilated tube which we can see in the ultrasound sometimes, or there might be a cyst, blood filled cyst, which we call as chocolate cyst. So these kinds of findings we can see in ultrasound, and thereby we can diagnose endometriosis. The third thing which by which we can see the endometriosis is MRI. MRI is a very good imaging modality to diagnose deep infiltrating endometriosis, to diagnose the adhesions. And confirmatory diagnosis of endometriosis is made by laparoscopy. Laparoscopy is basically a keyhole surgery in which we make a incision through umbilicus, and we put a telescope inside the abdomen, and we can see the endometriotic implants. Simultaneously, we can stage the disease, whether it is stage 1, stage 2, stage 3, stage 4, and we can, if minor correction is needed, like if there are flimsy adhesions, if there are smaller cysts, it can be treated simultaneously. And based on the disease staging, we can decide further treatment. So this is the diagnosis of endometriosis. Now we will understand how endometriosis causes infertility. So there are multiple mechanisms which has been explained for infertility in patients of endometriosis. Because of the main thing which causes multiple problem is the adhesions. Because of chronic inflammatory nature of the disease, there is a lot of cytokines, prostaglandins. So chronic inflammation leads to scarring and distortion of pelvic anatomy. So basically, we understand that in each cycle, the ovaries produce one egg. Either right ovary or left ovary will produce one egg. This egg will be transported inside the tube, and in tube, because of ciliary motion, the egg will be transported forward, and in the mid part of the tube, the egg meets with the sperm, which is very crucial step for fertilization. So in endometriosis, the tubal anatomy is distorted. The tube might not be anatomically correct. So because of scarring, because of adhesion, the tube-ovarian relationship is damaged or disturbed. Hence, transport of egg doesn't take place. The second mechanism by which endometriosis causes infertility is because of altered immune status. These endometriotic implant, release so many cytokines that it has been demonstrated that around the implants there is a lot of phagocytes. So these phagocytes can eat the sperm. Also, because of chronic inflammatory nature of the disease, the quality of the egg is also not that good. It also affects implantation of pregnancy. It alters the endometrial receptor expression. So the infertility is because of multiple factors. It is because of the problem in anatomy. It is because of the quality of the egg. It is because the fertilization is not possible. It is because the implantation is not taking place properly, and also continuation of pregnancy. So, endometriosis causes infertility due to multiple factors, and these are the factors which has been studied. There are so many factors which are being studied right now. So, what is the treatment? Now, treatment for endometriosis is mainly hormonal, medical, or surgical, as for other disease. So, medical management, usually we use NSAIDs and hormonal pills. Hormonal pills and injections. Since hormonal pills and injections are basically considered anti-fertility treatment, on while taking these medications and injections you cannot conceive. So when we talk of infertility, then there is no medical management for endometriosis. Depending on what is laparoscopic staging of the disease, we decide for either mild surgical correction followed by IUI, or if it is a advanced stage 3, stage 4, then basically IVF is the treatment of choice so far as fertility is concerned. So, in endometriosis is definitely a very big problem. Approximately 170 million females are suffering from endometriosis. Many of them are misdiagnosed or not diagnosed. So, the take-home message from today's talk will be that identify females in in your family, in your vicinity, who are having painful menses. Like many a times, elders in the family say that it is normal to have uh, pain during menses. It is true that pain is a mild pain during menses is normal, but if this pain is debilitating, if it is not letting you to do your work, then definitely it should be evaluated for endometriosis. Thank you so much. If there is any question regarding endometriosis, its treatment, its pathogenesis, etiology, then we can discuss. Okay. Uh, Thank you so much. Endometriosis is not a topic which can be discussed in 15-20 minutes. It is very vast topic, and there is lot of confusion about the topic. I have tried to explain the crux of the topic. If anything left, if any question you have in your mind, you can definitely post in the comment box. Thank you so much for your patient listening.